Hello, welcome to Adapt NCLEX, and thank you for joining the channel and deciding to watch this video. This is the part 2 of the March Neuromex for the NCLEX. Today, I just decided to focus on mental health. I think it's very, very high yield in medications that when you know them, these are frequent flyers of your exams, and so you have to know these medications no matter what. They may show up most of the time. If they have to ask you a question on any mental health question, some of them will fall under that. So let's look at them. So we have Clozapine, Sertraline, Lithium, Haloperidol, and Ziprasidone. So the first question is a client with schizophrenia was prescribed Clozapine. Which of the following statements need intervention? Select all that apply. Like I said, I decided to use this as a form of SATA question so that I can give you most of the information about the medication so that you can know them, and I will indicate the key priority function for which one is the most important for them. So it's a SATA question. The way we do it in Adapt NCLEX way, we read the last portion, SATA question, which of the following statements need intervention? That means you have to intervene. Patient is saying something that is wrong. A client with schizophrenia was prescribed what? Clozapine. The key for NCLEX pharmacology is one, they give you the medication and then they give you the indication. And when you do that, you expect a SATA form. They're going to ask you a bunch of questions about that medication and for them to know if you know it, you know the priority action and what to do with it. Or they can give you the diagnosis and they tell you which medication you can use and what kind of side effect you expect. So our buzzword is a patient who is a schizophrenic given Clozapine. And then the keywords are those the same thing. And the content is you have to know schizophrenia is a psychotic problem. And then Clozapine is another medication it's an antipsychotic, basically, is atypical antipsychotic. There's two types. There's one which is typical, that is the old generation, and two is atypical. These medications are very, very dangerous and they have a lot of side effects. So that's why they act a lot. For these atypical symptoms, they usually have cholinergic effect, and then they have specific symptoms for themselves. And I use Clozapine. It's the same thing if they give you olanzapine. Olanzapine is also the same. The only difference is olanzapine, mostly the symptoms will be like weight gain. So if they're going to ask you a question about olanzapine, it will be about weight gain. Clozapine stuff is what I've indicated, but both of them are atypical antipsychotic. So you have to know certain things about this medication, and I've given the key facts about it. I will monitor my sugar level. Yes, it causes hyperglycemia. Most people don't talk about this. It causes hyperglycemia. It's not that important. It's not a priority action. When they ask you the priority action, it's not that important. But this is a sort of question. So you just finding which medication, which information require intervention. Patient is monitoring their sugar level. The thing causes hyperglycemia. So yeah, you don't need to intervene for this one. I will need frequent lab draw. Yes, this is a very, very important. The key priority issue with this medication is agranulocytosis. And that means it causes neutropenia. It decreases your neutrophil. Therefore, you need frequent CBC so that we can know what your neutrophil level is. So this patient needs frequent lab draws. So that is a good answer, but we are not intervening. We're looking for something we can intervene. So this patient is saying the right thing, so we don't need to intervene. But this is related to agranulocytosis. I'll report any URI symptoms to my HCP. Yeah. with agranulocytosis, any little low temperature, 199 going to 100, you have to report it. As soon as you start having runny nose, diarrhea, coughing, you have to tell your doctor that this is happening. Otherwise, you're going to become septic. That is a B-sharp moment. It's a sepsis. So this is good to report it to your primary care, but you don't need to intervene. I will minimize my magnesium intake. This is another issue I want you to learn. I put it there because most people don't talk about it. Clozapine, we always say agranulocytosis, but the other symptoms they cause is QT prolongation. You also elongate your QT. Guess what? If you elongate your QT, that's a cardiac problem. And this causes what? Torsade de Pontes. So this patient will have Torsade de Pontes. Therefore, we have to make sure their magnesium is normal. Okay, that is the number one cause of Torsade de Pontes. So minimizing your magnesium level is a bad idea. So this we have to intervene. I'll start going to the gym. Yes, it causes weight gain. Clozapine also causes weight gain. So some of the signs and symptoms, like I said, is hyperglycemia, agranulocytosis. Agranulocytosis, it causes QT prolongation, and it causes weight gain. Those are some of the signs and symptoms of this medication. The priority one is what? Agranulocytosis and QT prolongation. Those two are very, very important. This is number one, and this is number two. If they ask you for priority action, the weight gain is not that important. The sugar level is not that important. But for this, we intervene because of patients saying that they need to minimize their magnesium. If they do that, they will develop QT prolongation and Torsade de Pontes. So the answer choice is just one, number D. Okay. Second medication. A client was prescribed Sertraline for a long-standing depression. She presented to the emergency room with a temperature of 103 after taking antibiotic for skin infection. Which of the following the nurse should anticipate on assessment? So this is a long thing. This is how you have to break it down, go to ask, case, buzzword, rewrite. That's the way we do it over here. So what is being asked? You're looking for anticipated assessment, okay? What is the case? Then you read it. A client was prescribed Sertraline for a long-standing depression and present to the emergency room with a temperature of 103. So I have a patient who present with 103 on Sertraline, and the buzzwords is the same thing. 103 Sertraline and depression. And then what are we asked to do? Anticipated assessment finding. So just by reading this, you can put it together in the content way that I have a patient on Sertraline, present with the temperature of 103. The client has depression, and after taking antibiotic, this happened. What do you think? This is serotonin syndrome. They shouldn't have fever 103 just like that by just walking to the emergency room, but they take some antibiotic for some infection, and all of a sudden, they have what? Blood pressure, temperature of 103. What does that mean? Yeah, this is serotonin syndrome. The antibiotic they will be taking may be Linezolid. This acts like the MAOIs that releases more serotonin. Therefore, they have a lot of serotonin coming from here and a lot of serotonin coming from Sertraline. So now they have serotonin syndrome. Based on that, you say, what is serotonin syndrome? Well, everything goes up. Everything. I'm looking for upgoing symptoms. And I'm going to use this content to answer the question. Hyperreflexia. It sounds like something is going up. Agitation. sound like something is going up. Tachycardia, sound like something is going up. Cold intolerance, look like I'm going down. But check it. The temperature is high. These people, your temperature is already 103. Do you think this patient would like any more heat? No, they would like to be cold so that they can cool them down. So the patient will rather love cold. So cold intolerance is the wrong answer. Tremor, sound like something is going up. Sweaty, something is going up. So this is what you expect in serotonin syndrome. Everything goes up. So hyperreflexia, agitation, tachycardia, tremor, and diaphoresis are our symptoms. But you read the question, figure out, put it together in your own word, come up with the content. And if you know what you're looking for, the answer choice is just a breeze. You just breeze through easily. But you have to make the diagnosis based on what I've given you. And so anybody on SSRI, Sertraline, and or ferritin, whatever they give you, and they give you temperature, think that they have serotonin syndrome. Next one. A client with bipolar disorder has been on lithium for a refractory disease. Which of the following statements need immediate intervention? So SATA, the same thing. At that enclosed way, we read backward. Which of the following need immediate intervention? Asked means you got to intervene. What is the case? A client with bipolar on lithium. So bipolar on lithium. Buzzwords, bipolar, lithium, immediate intervention. Then to make a choice, you got to come up with the content and then move on. What is the content? Somebody with lithium is bad. He has a narrow therapeutic index. Therefore, any small level increase can cause problem. Number one teaching you tell this patient on lithium is to avoid what? Dehydration. But guess, look at what I'm going to do. Avoid dehydration. It can be any way. The most common organ that is involved in regulating your fluid status is your kidney. So if you want to avoid dehydration, think about your kidney. Don't do anything that will affect your kidney. Don't do anything that will affect your kidney. And don't do anything that will affect your kidney again. Second thing is GI loss. Don't affect the kidney. And number two, don't lose it from the GI. Therefore, number one sign of lithium toxicity is the GI loss, because you can avoid things from happening to your kidney, but then you can lose it from the GI. So number one, early signs of lithium toxicity, look for GI loss. The same thing, all bad drugs like digoxin, most medication that have a narrow therapeutic index, the earliest signs of toxicity is always GI symptoms, because your body can tell that something bad is about to happen. So they will tell you to make you nauseous, you have diarrhea, so that you don't take it anymore. That's the way I think about it. If you are nauseous, you're not going to take the medication anymore. So that's the body adaptive way of preventing you from putting anything in again. So how can I prevent the kidney from getting damaged or causing dehydration? Well, I would drink a lot of water. I would drink 2 to 3 liters of water a day. So this is good. I don't need to intervene. I will avoid NSAID. NSAID is the number one killer of your kidney. Therefore, good idea. I will minimize sodium intake in my diet. This is a trap. You want to make their sodium normal as much as possible. Low sodium is another cause of lithium toxicity. Therefore, you should not allow the patient to lower their sodium. Tell them to eat some salt tabs to make their sodium normal, or try to get normal sodium that is needed amount in a day. Therefore, minimizing sodium require intervention. I will take Zofran for nausea, negative. GI symptoms, that is early signs of toxicity. Call your doctor or come to the emergency room. I will call my PCP with any diarrhea. Yes, GI symptoms, fluid loss. Therefore, calling is a good idea. You better call. So we don't need to intervene. I will need a substitute for my hydrochlorothiazide. Yes, this most people doesn't know. Thiazide is one of the medication that causes lithium toxicity. It's related to how the kidney get rid of it. At the same time, dehydration, but specifically related to lithium interaction to the kidney. And therefore, hydrochlorothiazide, we need to change it to another blood pressure medication so that we don't cause toxicity. Therefore, the things you need to intervene is minimizing sodium and taking Zofran. The rest of them are appropriate. Okay. Number 4. So, a client with refractory schizophrenia was started on Haloperidol. Client presented to the emergency room with a temperature of 102, 104. Which of the following is a priority assessment? So the same thing, adapt NCLEX. We look at it backward. Which of the following is a priority? You see, I put priority. This is not a SATA question, it's a priority. What is the issue? A client present with the schizophrenia, so psychotic was started on Haloperidol. The client presented to the emergency room with a temperature of 104. So I have Haloperidol, and I came in with a temperature of 104. What is going on? First, you have to know what is this haloperidol. This is an antipsychotic. This is the early generation. This is the typical ones. The typical ones are dangerous. That's why we came up with the atypical ones. But then we figure out that we are not out of the wood yet. The atypical ones to causes problem. And therefore, both of them are dangerous. So a typical antipsychotic. Anybody on antipsychotic, whether typical or atypical, with temperature that high, 104, high temperature, this is over 103, this is neuroleptic malignant syndrome. And this happened due to the interaction of the medication. And therefore, this is a priority. That's a B-sharp moment. This patient needs to be seen immediately. They have high temperature. They have autonomic dysrhythmia, basically dysfunction. Okay, everything goes up. And then number one priority, the whole muscle contract. So they have muscle rigidity. This is one of the groups of the hot guys. I call them thyroid storm, Neuroleptic malignant syndrome, Serotonin syndrome, and then and the last one is malignant hypotemia. So all of them causes the same symptoms. You just have to know the scenario. This scenario, we give them antipsychotic, they are psychotic patient, and therefore this is neuroleptic malignant syndrome. Priority action, well, they're going to be tachycardia. It's not a priority action. Muscle rigidity, yes, this is your priority action. Increased heart rate, yes, I expect that. It's not going to kill them. Hypertension, yes, I expected that. But we got to relax the muscle. The muscle is over contracting, releasing too much calcium. It's just physically contracting too much. So we need to give them some medication that relaxes the muscle, and then you cool them down. That's the treatment. So our priority action is to look for muscle rigidity. That's number one. And the last one. This is my favorite. Okay. It's Ziprasidone. People don't talk about it, but this is very good medication. Geodone. We use it all the time. So it's a set of question. A client was prescribed Ziprasidone for intractable recurrent mania. You can use it for schizophrenia or psychotic. Which of the following the nurse should include in the care plan? So what is the ask care plan? What is the case? We have psychotic patient prescribed Ziprasidone. Buzzwords, the same. Psychotic, Ziprasidone. Then your content, what is Ziprasidone? Whenever you see Dawn, okay, these are another group of antipsychotic. They are Dawns, antipsychotic. So they are also atypical antipsychotic like Clozapine, but they're different. But this is another antipsychotic you should know, Ziprasidone, when you see the Dawn, okay. These medications have specific side effects, and I'll put them here so that you can know them. The way I do my questions is I put them there so that you can be familiar. I either change it the wrong way or the right way, but the key information is over there. So what did they cause? Ziprasidone, which is atypical antipsychotic. You have to have a seizure precaution. They lower your seizure threshold. Therefore, this patient has to be on seizure protocol. So the nurse should include this. Cardiac monitor. Well, you say what? Why did that need to be on cardiac monitor? There's two things. Okay. You lower your potassium, so it causes hypokalemia. So one, you got to be on cardiac monitor. And two, guess what? QT prolongation, another QT prolongation. Remember, Clozapine, the same thing. These guys also do the same. QT prolongation. QT prolongation will lead to what? To Torsade pontase, okay? And what causes that? Low magnesium. Therefore, we got to make sure your magnesium is normal. So, monitor for potassium, yes, because it causes lower your potassium. Monitor for your magnesium, yes, because it causes QT prolongation. Monitor for hypertension, no, it causes hypotension. Hypotension. Why? When you're having QT prolongation, yeah, everything becomes bradycardia. This is will lead to heart block. Okay, when you have QT prolongation, heart block. And therefore, these medications, you watch for hypotension. That's why they have to be on cardiac monitor. The potassium is low, you have to be on cardiac monitor. Magnesium, you got to monitor it, seizure precaution. So this medication is dangerous, but we use it all the time. So it's very important to know everything about it. So which of the following we should include in our care plan? Seizure precaution, cardiac monitoring, potassium, and then monitor for their magnesium. These are key factors. If they ask me for priority action, I'm going for the the Tosad. The Tosad de Pontes is dangerous. I don't think they will put all of them together, Tosad and magnesium, but this is QT. It causes QT prolongation. So priority action is this one. The potassium is the secondary effect is because after you've been on it for a long time, but the most serious that will occur right away is heart block. So QT prolongation is my priority action. So thank you for watching. Thank you for listening. I've given you key 5 good mental health medication. If you know it when you see it, I mean, you just come straight forward. The key fact I'm giving you. Take care of yourself and continue to follow the series. Check Adapt NCLEX for if you trying to find content, free content, and then you can join us on Saturdays and learn something If you have questions, email us, and we will be happy to help you. Take care of yourself. All the best of luck. Keep charging as always. Bye-bye.